Hi, everybody. Thank you for joining us today. As I said, my name is Kelly Mann, and I'm the Director of Programs with A Time to Heal. And we're going to start off with just a little announcement from Brenda.
Well, good morning, everyone. I'm Brenda Helgett. I'm Executive Director of A Time to Heal Cancer Foundation. And I just wanted to again say hello, welcome, thank you for being here. And I really want to say thank you to Nebraska Cancer Specialists for sponsoring all of our Create Your Best Life events, including our session today. And when I say all of them, they started doing this this last month, and they will continue throughout the year and next year. So for a full year of events, they're going to be sponsoring this, and they help us and enable us to bring this to you for free and to record the event. So Nebraska Cancer Specialists, they are a proud supporter of A Time to Heal and have been for some time. And together we are committed with them to providing exceptional care and continued support to patients, families, and caregivers. So if you want more information on Nebraska Cancer Specialists, please go to what you see on the screen, nebraskacancer.com. So thank you again so much. And I'm going to let Kelly introduce our wonderful speaker today.
Yeah. Thanks, everyone. Joining us today, we have Mary Grace Zeleny. She is a professor and educator at the University of Nebraska-Lincoln. And right now she's finishing her practicum in Cultivating Compassion, which was developed at Stanford University. Mary also facilitates our Survivorship 101 with A Time to Heal. She is a licensed mental health practitioner, a cancer survivor, and a caregiver. And we are very fortunate to have her with us today. Welcome, Mary.
Thank you so much, Kelly. Thank you, Brenda. And thank you all for being here today. As I said, it's so important just to know we're not alone and to be together. And so I'd like to start out, since we have a group, a really nice group here of 13. And I just would like to just quickly go around, and if you could just say your first name and what brought you here today, just something briefly.
I'll start. I'm Mary Ann. Actually, it's my roommate who couldn't, wound up not being able to be here, who saw it advertised, and she is my caregiver. And she said, I think this would be a good thing to do together. So we'll watch the recording later.
Thank you, Mary Ann.
I'm Karen, and I was a cancer survivor for ovarian cancer in 2016, and last year I was diagnosed with breast cancer, so I guess I'm surviving twice. I did the Time to Heal back in 2017 after the ovarian cancer.
So nice to see you, Karen.
Thank you.
I'm Dorothy, and I'm a breast cancer survivor, and now I'm currently a caregiver for my husband. So that's what brought me here today.
Thank you, Dorothy. So glad that you're here.
I am Sister Hilda from Norfolk, Nebraska. I am also a cancer survivor, and I am here because I love the compassion and the empathy part, and I am aware of the caregivers, how hard it is to give care to these, chronically ill patients and things. And so, in any case, I just want to learn more about the cancer and caregivers. Anything I can learn, I am for it. So that's why I'm here.
So nice to have you here, Sister Hilda.
Thank you.
Hi, I'm Rodney. I'm married to Treva. I'm here because I just wanted to see some of the things that she's gone through with you guys already, and to just kind of get a different viewpoint from other people.
Oh, Rodney, it's so good to have you here.
Thank you.
I'm Carolyn. Can you hear me? Okay,
Yes.
I didn't know if I pushed the right button or not. And I'm a caregiver. My husband has a blood cancer and is crabby a lot and makes me crabby too. And I just want to know how to be a better caregiver.
Mm. Carolyn, thank you. And you know what? We're going to be talking about some of that. Thank you.
My name's Joanne. I'm a 3-time cancer survivor. My last diagnosis was last September. And I underwent a bilateral mastectomy in November, and I got COVID right after that. So that was exciting. So I went through the Time to Heal class just not too long ago. So I'm just here learning to survive more.
We're so glad that you're here.
Thank you.
We hope that there's some things that you can take away from today.
Thank you.
I'm Agnes, and I am currently in breast cancer treatment. And I also took the Survivorship 101 class recently. And I also have family that are fighting cancer. And I'd like to just learn more. Thank you.
We're so glad that you're here, Agnes. And did you say that your family there's some cancer in your family now?
Yes, yes.
Thank you. Lisa, would you like to introduce yourself? Okay.
I'm Ron. Lisa she went and laid down.
Oh, okay.
The smoke from the other day got her
Uh,
with all the after effects from her breast cancer. Everything happens, but I'm here to I'm kind of her caregiver, so I'm trying to learn things. So
that is compassion. Yeah. And please tell her we're thinking of her. Okay. Is there anybody else that would like to say something? Okay. I wanted to really spend time doing these introductions. And as you can see, I use the chat as a sort of whiteboard here. This is because when we can see, we've heard each other, we're sharing our experiences and sharing ourselves. And now you can see that right here in the chat. It's pretty powerful to have that in words because we'd like everybody to have a voice. And we know that sometimes we feel our voice is so small in the midst of difficult things regarding cancer. So you all have a voice, and we just value whatever you share with us and just being here. Thank you. So I'm going to share my PowerPoints kind of intermittently, but most of all, I want to see your faces. So I'll share PowerPoints and then I'll come back to you. Okay, so right now I'm going to share a couple PowerPoints. And let's see. It didn't share. Oops, that did not. Okay. Sorry, it didn't go to my slides. So I'll try that again. All right, there we go. And we'll go to the current slide. For some reason, it is a little bit slow today. So as we know why we're all here, and mostly we're all connected by cancer. And, just that heartfelt, how can I do something for myself or for others, or just to learn about that? And I want to show you this, that we're going to do in a moment, a little settling practice, which just involves kind of getting settled and being here. And you'll see why we're doing this throughout the presentation. It's some sort of practice that can actually be helpful. And then we'll do a little writing reflection. And then I'll introduce you to the concepts of empathy and compassion. And then within empathy, I'd like to talk about empathy in general, empathy distress, and empathy concern. Then we're going to talk about compassion for others and for selves, and then loving kindness. And then we'll go into a couple other things with that, but those are the main things that we're going to talk about. And then, as Kelly said, we will go into a small group discussion about those concepts. So empathy and compassion. Sister Hilda, I'm glad that you said that that drew you to this, just to kind of find out, some things about empathy and compassion. We hear about empathy a lot and compassion, and I wanted to point out some similarities and differences about them. And then what are some key elements of that? Okay. So first of all, just in general, empathy is when we can feel with somebody, when we can feel maybe what they're going through, what they're experiencing. And that's the feeling part of it. And then the other part is the cognition part, the thinking part, is understanding the perspective, understanding the perspective of another of what they're going through. So the feeling and understanding. Then compassion is really an action in general, an action to help alleviate suffering, whether it's for others or for ourselves. I did want to note this too, and throughout the slides, you'll see that I've integrated some of the research that's going on, but briefly, there are research studies with empathy and compassion in our brain. So for example, in the study that Singer and Klemke did in 2014, they demonstrated that with practicing compassion, the brain can transform with neural pathways that we can then experience joy, calm, peace, and even in the face of difficulty. So with that practice, we can actually change some of our pathways that we can experience more joy and calm and peace, even through challenging times. So our brains have plasticity. That means our brains can change, which is really great. Also, empathy and compassion promotes pro-social behavior and positivity, as well as coping strategies in positive ways. And you'll see on my slides too, that I have put some resources or the references there, which you'll see also on the last page. So let's begin with empathy. Empathy is an interrelating to someone's story, an interrelating to someone's pain or discomfort. And again, it's feeling with someone versus for someone. So it's not pity for somebody, but it's feeling with somebody. We're understanding what they're feeling. And also, as I said before, it's perspective taking. So perspective taking involves our imagination. How can we imagine what they're going through? And also empathy is letting somebody know that they're not alone. We show them that we're feeling with them, and by listening. And it's really an awareness and connection with somebody else in non-judgmental ways. And for those of you who like extra reading, Paul Gilbert has a lot of information on empathy and compassion and then also with our brain. And then I've also referenced here Bruce Perry, who's done a lot of trauma work as well. I'm going to stop sharing for a moment. So any thoughts so far? Okay, I'm going to go on in just a moment. So most of us have experienced empathy with others. And I'm going to show you a slide now that really demonstrates one piece of that. Okay. So as we can see, there's empathy in the middle, and empathy also, there's these branches, or as you can see, I've created circles of nurturing, love, caring, relating, understanding, and communication. And so, of course, when we can feel empathy with somebody, that we are showing them this love and this nurturing space and the caring that we have for them. And it's also relating to one another. So as all of you related some of your stories, I'm sure that all of us were saying, yes, we understand some of that, or we want to understand some of that, or we want to have perspective on that. And that's all part of empathy. Now, as we know, this is, really geared for caregivers, but I'm really glad that even if you're not like the official caregiver for somebody, you are still a caregiver of yourself. And so I think it's appropriate for all of us to be here as caregiver and care receiver. And I'm going to stop because I want to read you something that I wrote, just kind of depicting this. And so I am writing a book about my caregiving. There was one period of time that actually, when I came out of my own cancer experience, about 5 years out of that, that 3 members of my family within 4 years became ill and then died. But the things that I learned from being caregivers to these family members was invaluable. So I want to read you a part of what I've written. I listened to him as he teared up, letting us know about his cancer diagnoses. My mind darted in many directions. What can I do? How can I help? Maybe this will pass. He's crying, and that's not like him, I thought. What I finally settled on with peace was to just be present. Then I really listened with my mind focused on being present and letting him know that. I didn't even have to say anything, but listen. That was the valuable gift he needed, and he said so. He said, just by you listening really helped me. Thank you. So now I'll share my screen again. So empathy as caregiver. So within this space of empathy, this concept of empathy, I want to focus on empathy for others. And again, that's feeling with or perspective taking or sharing the feelings that somebody's feeling. And then there's something called empathy distress. This is feeling with, but maybe being overwhelmed, or feelings of being frozen or avoidance. And then empathy concern, which I'll get to in just a moment. So focusing on, so we know what empathy is, but then there's something now that it's relatively new of what they're calling this. It's called empathy distress. And this is when we might feel so much empathy that we might experience feelings of being overwhelmed or feelings of not knowing how to help, or maybe being frozen. And frozen, by frozen, I mean, maybe we just don't know what to do, so we do nothing. Or we avoid somebody, or we avoid the situation. I can tell you an example of empathy distress. Going through cancer, I wondered why some of the people closest to me weren't coming over, in person, or why some people stopped talking to me. And what I found out much later was that they didn't know what to do and they felt helpless. So helpless is another feeling that goes along with empathy distress. Now, empathy distress is, they have done research on this. All of this is research based. They used to call it compassion fatigue, but now they are really thinking that it's really empathy distress. And I'll tell you why when we get into compassion. Again, Paul Gilbert really is one of the persons leading on this in empathy distress. So now we've talked about the general definition for empathy, and then empathy distress, but now empathy concern. As you can see, I have this kind of highlighted in color, on a colored kind of slide, but now empathy concern is feeling with somebody, yet we're distinct from the other person. So that means that, sometimes if we're really close to somebody and we're feeling empathy and we feel overwhelmed, we don't know what to do, that's empathy distress. But this one, we can still feel empathy and love for somebody, but we still have that distinct from other. So we nurture a more concerned and practiced response while maintaining what is called equanimity. And equanimity is our regulation, so to speak, of being peaceful and calm, even in the face of very difficult challenges. And this empathy concern, these feelings with another and perspectives with another can lead to the act of compassion. Before we get into compassion, though, I would like to hear from you in this writing reflection. So here is the reflection prompt. And so if you could find something to write with and write on, I'd like for you to reflect and write something about this. Have you ever felt empathy distress? And if so, give us some examples of that in your writing. Can you think of a time that was different from empathy concern? And so we're going to just take a couple of minutes for you to write down some thoughts about this. And then we're going to share with each other briefly. So I'm going to stop sharing this, but I'll put this in the chat. But I'm going to stop sharing my slides in just a moment. And then go ahead and take time to reflect on that. Okay, we'll take just about 40 more seconds, and wherever you are will be just perfect. Find a place to pause in about 10 seconds. Okay, so now we're going to take maybe just about 3 minutes or so to share, if you're comfortable, and you don't need to share. Now, by sharing, you can either put something in the chat or share out loud, or you don't need to share. Whatever you're comfortable with. Okay, does anybody, would anybody like to share something? Oh, Marianne, you're on mute.
About 40 years ago, I was about halfway through my ministry training, and I received a call from a close friend saying that her sister, 8-year-old sister, had died that afternoon from an epileptic seizure. And would I please come over and visit with her, be with her family that night? So I was, of course, so I'm driving over there, and I thought, oh, wait a minute. We didn't get to that part in training yet where you learn all the perfect things to say in a terrible situation like that. And said, well, I guess I'll come up with something. And so I got there, and we just sat and talked about the little girl's life and how her family was feeling. And we cried together and we laughed together over some of the stories. And that's what they needed from me then. It was tremendous.
That's beautiful, Marianne. And so I'm hearing that you were there and you didn't feel overwhelmed with it. You weren't frozen, but you knew that that's what they needed. And you were with them. That's beautiful. So that is actually one piece of empathy concern leading into compassion. You actually went into that active compassion. Yeah, thank you. Beautiful.
I think I deal with the frozen part. I mean, I had my own issues, but I think, excuse me, it's easier for me to to go to somebody that I know than to somebody that I know who they are, but I don't have a relationship with them. But we know who, I know them and they know me, but I mean, we don't really know each other, you know what I mean? So then when, when it's, when they go through something like, a death of a spouse, particularly, which I haven't dealt with, it's very difficult for me to make myself call and just say, I'm thinking about you, which I can normally do with somebody that I know better, that I have a relationship with and we kind of know each other. So that's what I deal with, but I've experienced so much empathy and compassion in my own recurrence of cancer and having cancer in the first place. So I know what it's like, but I really struggle with the freezing up with people that I don't know so well.
Thank you, Karen. And you're just really speaking authentically in people, and you're not alone. Many people. Yeah. And I hope that you have no judgment about that for yourself either. And we'll get into that too. But thank you.
Yeah, I think I do.
Oh. Okay, if there's one more person who'd like to share.
I'll chime in. First off, apologizing for being a little tardy, but Mine, I guess, was very, very direct and personal. Was when my wife was first diagnosed, and it was almost like I was paralyzed. I just didn't know what to say. I didn't even know what I was feeling, and um, I knew I should be offering comfort, and um, I don't know if it was going through the motions at first or forcing myself. I mean, I felt pain, but I wasn't totally in touch with my feelings. Not that I ever have been, but you know, again, being in the situation where I am here all the time, it first off went into my I don't want to say going through the motions. I knew what I had to do, and I had to force myself to do those things. But as time progressed, and I have to say, and I think that to me this is terrible, but it wasn't until uh, as we were going through the chemotherapy, probably towards the end of her treatment, and I guess this is a plug for A Time to Heal. But after getting involved with one of the programs here with A Time to Heal, um, I actually found myself getting better in touch with my feelings. And at one point, I was given the opportunity during that course to express my feelings, and that's where I turned to the camera and didn't look at my wife, and I basically unloaded, and it opened everything up. So um and it gushed out, and I think my wife for the first time realized that I had all these pent up emotions that I wasn't sharing or couldn't share. And I think largely because uh you know, my generation, you know, you were taught to be strong, you were taught not to express or feel those things. And you know, so there was an evolution there. But that's my story.
Joseph, thank you so much for sharing that. I mean, that is coming right from your heart, and it shows an awareness of feeling and an open heart. Thank you. So now I'm going to go on. We're going to leave empathy in just a moment, and we're going to go into compassion. So as we saw, there's empathy, the overall kind of definition of that concept, empathy, distress, and then there's empathy, the empathy, care, or concern. But now compassion is a recognition of discomfort or suffering, and then the action that is taking toward that to alleviate that discomfort or suffering. So it's actually an active response to suffering, a behavioral action. As we know, suffering can take place in different ways. It can be an inner discomfort of anxiety, doubt, fear, or it can be an outer discomfort, pain, body discomfort, whatever that is. And as we know, as caregivers, as well as cancer survivors, that a lot of times we experience both of these inner and outer discomforts or pain or suffering. And so again, with compassion, there is a belief that we all have a natural inclination to help somebody, which hopefully we have the natural inclination to help ourselves as well. And from alleviating that suffering and doing something about that. But also an element of compassion is being non-judgmental toward that person, as well as being non-judgmental toward ourselves. And with compassion, it's also a sort of recognition that there's a sameness of self and others, that just like me, the other person would like to be free of suffering. Just like me, the other person would like to be free of pain, and vice versa. So what are your beliefs about giving and receiving care? And this is just an aside, you can jot some things down, but giving care to others, giving care to self, or or receiving care from others. And if you could just jot those down, we're not going to share that now, but I thought it would be a good framework to go on into compassion, because we're going to talk about self-compassion too. So what are your beliefs about giving and receiving care, which goes along with compassion? And let's just take just a minute. I'm going to time that minute to write that down. And I'll go on, and you can even keep jotting things down as they come to you. But what they say in compassion, and when we get into self-compassion, that sometimes our beliefs shape the way that we act. So how do our beliefs really impact how we give care to others? How do our beliefs about giving and receiving care impact how we give care to ourselves or receive care from others? Now, remember that most of us, maybe it's societal, I don't know, but sometimes it's harder to receive care or to ask for care. So now, compassion for others, specifically in caregiving. Here is a tidbit, and this is from many researchers, but I just picked out these: Paul Gilbert, Jimpa Tupin, and Kristen Neff. And the person who gives compassion actually might experience joy. And there are studies about that. In doing so, when you actually have an act of compassion, that you're doing something for somebody, you're also doing a compassion act for yourself, because true compassion most often gives you some joy in that act. And the act of compassion doesn't always require an in-person act. So when we talked about, that empathy distress, and earlier in times, people talked about compassion fatigue. But now what they're seeing in the research is that true compassion, an act that you know that you can carry out for somebody else or yourself, really gives you joy. So they're thinking that maybe when you're acting in compassion, that might be, that maybe there is not fatigue there, that maybe that's energizing. Paul Gilbert talks about this too, that we're all wired to be social beings, and social interaction gives us motivation, and it's in the brain too, that it gives us motivation and desire to be with one another and help one another. So the act of compassion doesn't always require an in-person act. We can decide to practice an action of intentional kindness. That it could be something such as showing appreciation for somebody, an intentional act of showing an appreciation. It can be an intentional act of thinking about somebody. So there are so many facets to compassion, but I just want to do this very brief practice. And if you feel comfortable, I invite you to do this with me. We're just going to do it for about 30 seconds. Usually I lead this in about maybe 15 to 20 minutes, but we're just going to do about 30 seconds, just so you know that even you can do this briefly for somebody. So if you are comfortable, I invite you to put your hand on your heart. This is called practice, hand on heart for a loved one. And think about someone, a loved one, that you'd like to send compassion to. And here's just a simple saying: may you be free from suffering. May you be free from fear and anxiety. May you experience peace and joy. May you be free from suffering. May you be free from fear and anxiety, and may you experience peace and joy. And so we'll end that, but I wanted to give you just one thing that you could take away, that really just takes a few seconds. I wanted to go back to caregiving and compassion. Sometimes that caregiving, caregiving takes a lot out of us. I know, sometimes we are doing everything for that person. And so that leads us to think about compassion for self. And so as caregivers, sometimes we might recognize that maybe we're feeling a bit, I don't want to use the word drain, but a bit, that we need help, that we need a rest, that we need some respite as well as caregiver. And so compassion for self. So self-compassion for caregiver, this is cultivating compassion for you. And with this, the kind of general concept around this is that it's important to activate a soothing inner and outer environment for yourself without any judgment. And the motivation is to alleviate suffering. So how can you do that as a caregiver? A couple things that we can do are we can pay attention to messages we might give ourselves. And, when we're tired or stressed out or hungry or, just any of those things that kind of drain our energy, if we're not getting enough sleep, we could tend to go toward negative thoughts about ourselves or self-doubt or negative thoughts about others. And if we don't have a respite for this, if we don't give compassion for ourselves, it can lead to habitual patterns. And so one thing that we need to also do is to be aware of our own suffering, whether that's the inner suffering of anxiety or depression or outer suffering of maybe no sleep or hungry or, any of those things. Another act of alleviating pain and suffering is self-forgiveness. So, for example, when I was a caregiver, I was also going through my doctoral program and going through my dissertation when my mother was, when I was caring for my mother. And so I had a lot of negative talks, negative self-doubt about, well, should I be splitting my time between my dissertation and caring for my mother? I literally was sitting at a kitchen table doing my analysis for my dissertation while I was listening for her to see if she needed anything. After a while, I needed to do a lot of self-forgiveness about those doubts and to understand that I had many parts of my life and to ask for help. So that was somewhat an example of that. Again, Paul Gilbert, Jimpa, Kristen Neff, Singer, and Klimke really have a lot of information for self-compassion. But here's a quote I took from Kristen Neff's book. And actually I have this. It's the Mindful Self-Compassion Workbook. And I would recommend it. Can you see that?
No.
You cannot, because I have to stop sharing my screen. I'll show that to you in a moment. But here's the quote: embrace yourself and your imperfections. This will give you resilience to thrive. So how can you be more compassionate to yourself? We talked about some of those ways, but here's a couple more that you can try just as a thought experiment. You might try writing a loving letter to yourself as if you were writing to a friend. So being a friend to yourself and actually writing that letter, you would be surprised at how powerful that is. It could be just a short letter. Or you can notice when you have negative thoughts about yourself and reframe those thoughts into positive ones. As a caregiver, and we're going to talk more about this in our small groups, as a caregiver, you can also ask for help when you need it. So you can get sleep, so you can eat, so you can take a rest, take a mental break. So now I'd like to do another practice for you, compassion for self. And again, I invite you to put your hand on your heart. And this is the practice, hand on heart for self. And so if you want to do this, I invite you to put your hand on your heart and take a deep breath in through your nostrils and slowly out through your mouth. And imagine a compassionate image, whatever that image is, that is unconditional. This image is an image that brings to mind an unconditional positive regard for you. And as you breathe, find the natural rhythm of your breath. And what that image is, when you need self-compassion, you can just think about this image that will remind you to engage in self-compassion unconditionally and non-judgmentally. And now inwardly repeat this phrase. May I be free from suffering. May I be free from fear and anxiety. May I experience peace and joy. And let your heart be touched by this feeling of warmth and tenderness and caring for your own needs. And rest your mind simply on your natural breath. May I be free from suffering. May I be free from fear and anxiety. And may I experience peace and joy. And now we'll come back to the group. Here's a quote also by the Dalai Lama. If you want others to be happy, practice compassion. If you want to be happy, practice compassion. Okay, I'm going to stop here for a moment and I want to check in with the group. How are you doing? Okay, now I'm going to go on to our last things, and this is called loving kindness. So far we've gone over empathy, so feeling with somebody, or perspective taking on somebody, with somebody. And then we've gone into compassion, to be aware of pain and suffering and do something to alleviate that, whether it's for someone else or for yourself. And now this is loving kindness. And so I'm going to share my screen again. So loving kindness, and by the way, Barbara Fredrickson is the person who really has so much research in this area. And, again, I'm just giving you just very brief little synopsis of these things, but there's so much more. But loving kindness is really intentional thoughts or visualizations or small actions, everyday actions that really evoke positive emotion. And that positive emotion could be love, it could be contentment or compassion, but it's really simple everyday joys. And so this loving kindness that I specifically chose for today is loving kindness for yourself. You can also practice these simple everyday joys for somebody else too. So remember, intentional thoughts, visualizations that evoke positive emotion. And it's simple everyday joys that you create. So some of the things within loving kindness too, there's a lot of research that shows that meditation in various forms help to give pause to our challenges and helps to kind of give our mind a rest and practice giving our mind a rest so that we can let everyday joys in or notice everyday joys. And this can also help train our attention. And in doing so, it helps with our problem solving too, because we know as caregivers, there's a lot of problems that arise and things that need to be solved. And so loving kindness for self is, something that if we practice it, that it can help us with caregiving and also with self-compassion. And so again, do something nice for yourself, whatever that is, something that's just a daily something. One thing that there's a lot of research in that probably most of you have heard of is gratitude. So if you practice writing down what you're grateful for, and maybe like before you go to bed at night, some people have a gratitude journal. You've probably heard about that, but it's true. There's research that supports it, that when we have gratitude and we can notice things that we're grateful for, it can really help give our mind a rest from the challenges and also help train our mind to practice the calm and the peacefulness even in the face of challenge. Another thing that you can do is pay attention to everyday joys and even just start with one thing. For example, what is one thing in your day that you found joyful? Just one thing. And so that too can help, really kind of change our mind and those neural pathways. So with this, I'd like to do one last hand on heart. I invite you to do this if you're comfortable. And with this, with your hand on heart for yourself, settle in so that you feel comfortable in your seat and take a deep breath in and out. And then focus on the natural rhythm of your breath. And with this very short practice, I invite you to just find two things that you're grateful for. And find a place where you might be able to relive that or bring up those gratitudes, those things that you're grateful for at some time that you need it. And now I invite you to think about one thing that you're grateful for about yourself. If you feel resistance, gently guide the resistance. Just look at it with some curiosity and see where that resistance is coming from. And maybe just set aside the resistance for just a moment and offer yourself one thing that you're grateful for yourself. And now I'd like to end that, and we're going to come back. So in looking at all of these, empathy, compassion, loving kindness, you can see how it's interwoven with how we can integrate this into caregiving by being aware of what we need and to take action with that. And also just giving ourselves everyday joys. And this will help us to be compassionate and do compassionate acts for others when we are called to do so. But this too, that you're not alone. Creating community is so essential. And the survivorship class that we just came out of, I have to say that they just had so many wisdoms and they had so many great ideas about creating community. But in creating community, we need to have an inner awareness of what we need about self and others, and awareness with others, and also the inner practice so we can practice with others with compassion, loving kindness. And part of that too, creating community can help us have time and space. And with that time and space that we know we all need, that can help us with our relationship with ourselves and others. Here, I've just put some just very short strategies in daily practice for empathy, awareness of feelings, including awareness of burnout, being overwhelmed, looking for signs. And when you have those signs, refilling your well, so to speak, or finding ways to kind of replenish and refresh. Also with compassion. Self-compassion is recognizing your own suffering and pain and discomfort and taking action to alleviate it. Compassion for others is recognizing others' suffering, pain, and discomfort and taking action to alleviate it. But remember, it doesn't have to be in person. It can be very simple. It can be an act of appreciation and loving kindness. Note gratitude and the simple joys and the everyday things. So now I'm going to stop sharing, and we're at 11:05. And I invite you to stay on. You know, I've been talking a lot and giving you a lot of information, but I invite you to stay on, and we're going to go over some questions in some small groups that I think, you know, the really gems are when you share with each other. Those are the gems that you find some strategies. Oh, Sister Hilda, do you have a question?
I'm just wondering, it like you said, it's a lot of information and wonderful information. And I just like, I don't want to take it all by myself, but I just want to share with other people. Is that okay that I do that?
Absolutely.
I think it just, you know, many people could benefit for this, you know, for themselves and others, family members. Thank you so much.
Thank you so much. Do folks want to stay around? I'm going to show you the questions and see if that resonates for you. And we can even pick and choose what questions that we want to look at.
Thanks.
Mhm.
Yeah, thank you, Mary. We appreciate your insight on this and your understanding of this topic. So thank you very much.